Ketogenic diets in dogs and cats. A comprehensive review. This audio summary provides a detailed overview of the article Ketogenic diets, a systematic review of current scientific evidence and possible applicability in dogs and cats, by Vendramini et al. 2024. It covers the introduction, study design, results, and discussion, including descriptions of figures and tables. Introduction. The history and types of ketogenic diets. Ketogenic diets, KDs, have been used in human medicine for almost a century, initially for treating epilepsy and more recently for managing conditions like cancer and obesity. These diets are characterized by high fat, adequate protein, and restricted carbohydrate content. This review focuses on the potential applicability of KDs in dogs and cats, examining the scientific evidence and exploring the neurobiochemical mechanisms underlying their effects. Historically, the dietary management of seizures involved fasting, which was observed to reduce intoxication and control seizures. Researchers noticed that seizure improvement coincided with increased serum uric acid and acidosis after 2 to 3 days of fasting. It was then discovered that ketonemia, a state characterized by elevated ketone bodies in the blood, could be induced not only by fasting, but also by diets very low in carbohydrates and high in fat. This led to the development of the ketogenic diet as a sustainable alternative to fasting. The classic KD, a high-fat, carbohydrate-restricted diet, mimics a starvation state without caloric restriction. It aims to produce urinary ketosis, evidenced by acetone and diacetic acid in the urine. However, the strict carbohydrate restriction made the classic KD unpalatable and difficult to prepare. In 1971, a modified KD incorporating medium-chain triglycerides, MCTs, was introduced, requiring less restriction of carbohydrates and protein. There are two main types of KDs: the classic ketogenic diet, primarily using long-chain triglycerides, LCTs, as the fat source, and the KD based on MCTs. MCTs are digested and absorbed more efficiently than LCTs and are rapidly transported to the liver for conversion into ketone bodies. LCTs, on the other hand, are primarily resynthesized into triglycerides in the enterocytes, forming chylomicrons that enter the bloodstream via the lymphatic system. This difference in metabolism makes MCTs more ketogenic than LCTs, as they produce higher ketone levels. Figure 1 visually depicts the contrasting transport and metabolism of LCTs and MCTs. It illustrates how MCTs directly enter the liver through the portal vein, leading to rapid ketone body production, while LCTs take a longer route via the lymphatic system and can be utilized by peripheral tissues or stored in adipocytes. The higher ketogenic potential of MCTs allows for greater inclusion of protein and carbohydrates in KDs, mitigating potential nutritional inadequacies associated with the classic KD, such as vitamin and mineral deficiencies. This is particularly important for children with refractory epilepsy who often require KDs. Studies have shown that both classic and MCT KDs are beneficial for epilepsy treatment. However, MCT KDs may be advantageous in minimizing nutritional deficiencies and side effects like vomiting, constipation, and hypertriglyceridemia. In dogs and cats, studies have demonstrated the benefits of MCT supplementation, such as improved seizure control in epileptic dogs resistant to anticonvulsant drugs. Other benefits include increased polyunsaturated fatty acids in the brain of older dogs and enhanced cognitive function in senior dogs. While some studies reported food aversion to MCT-containing diets in cats, others have found them well tolerated, suggesting potential benefits for feline metabolism. However, research on the effects of MCT-based KDs in dogs and cats remains limited. Ketone body production and neurobiochemical mechanisms. A central feature of KDs is the production of ketone bodies. When large amounts of fatty acids from dietary fat are oxidized in the mitochondria, primarily in the liver, they are converted to acetyl coenzyme A, acetyl-CoA. Acetyl-CoA typically enters the Krebs cycle. However, when fatty acid levels exceed the Krebs cycle's metabolic capacity, acetyl-CoA is diverted towards ketogenesis, resulting in the production of acetoacetate ACA and Greek letter beta-hydroxybutyrate BHB. ACA can further break down into acetone, another ketone body. Figure 2 provides a schematic illustration of ketone body production in the context of a ketogenic diet. It highlights the metabolic pathways leading to the formation of ACA, BHB, and acetone from fatty acids. These ketone bodies are then transported through the bloodstream to various tissues, including the brain, where they can be utilized as an energy source. The exact neurobiochemical mechanisms through which KDs exert their anticonvulsant effects are not fully understood. However, several hypotheses have been proposed. One theory suggests that ketone bodies modulate neurotransmitters, membrane potential, and ion channels. Ketone bodies have been shown to increase gamma-aminobutyric acid GABA synthesis, stimulating chloride channel receptors and inducing neuronal hyperpolarization. This inhibition of neuronal excitation may contribute to the anticonvulsant effects. Another proposed mechanism involves adenosine, a neurotransmitter with strong anticonvulsant properties. Adenosine A1 receptors, A1Rs, play a crucial role in seizure control. KDs have been found to enhance A1R activation, potentially leading to reduced neural activity, glutamate release inhibition, and neuron hyperpolarization, ultimately reducing seizure activity. KDs also exhibit neuroprotective effects, likely due to the antioxidant activity of ketone bodies and the activation of mitochondrial uncoupling proteins MUPs by fatty acids. KDs may stimulate the transcription factor NRF2, enhancing the antioxidant response and increasing the ratio of glutathione to oxidized glutathione, which contributes to neuroprotection. Physiological differences between species. Dogs have evolved from carnivorous ancestors to become omnivores, adapting to a diet that includes carbohydrates. While they can derive energy from cooked carbohydrates, they do not have a biological requirement for them. This suggests that omitting carbohydrates from their diet, as in a classic KD, would not be detrimental. Dogs' ancestral diet, rich in fat and low in carbohydrates, aligns with the high fat content of KDs, indicating their potential tolerance for such diets. However, it is unclear whether KDs would induce the same degree of ketosis in dogs as observed in humans and rodents. Studies evaluating KD effects in dogs have used modified diets with MCTs and higher carbohydrate levels than the classic KD. Despite the modifications, studies have observed increased blood BHB concentrations in dogs consuming diets supplemented with MCTs, suggesting a potential link between MCT intake, ketone body production, and the anti-epileptic effects of KDs. Cats, compared to dogs, retain more carnivorous characteristics. They exhibit a strong preference for protein and fat and have a pronounced aversion to carbohydrates. Like dogs, they do not require carbohydrates in their diet. Therefore, eliminating carbohydrates from their diet would align with their natural dietary preferences and might not have negative health consequences. It's important to note that ketosis is a metabolic state triggered by the absence of the primary energy source for a particular species or during fasting. For dogs, fat is the primary energy source, while for cats, it is protein. This differs from humans, whose primary energy source is carbohydrates. Consequently, eliminating carbohydrates in humans leads to ketone body production. Adverse effects of ketogenic diets. Despite potential benefits, KDs also have potential side effects. In humans, the nutrient profile of KDs, characterized by low carbohydrate, adequate protein, and high fat content, can lead to complications like nutrient deficiency, kidney stones, vomiting, constipation. Studies in children with epilepsy have reported adverse effects such as acidosis, constipation, diarrhea, hyperlipidemia, and hypoglycemia after consuming KDs. The low carbohydrate intake can result in hypoglycemia and deficiencies in essential micronutrients, due to the limited consumption of fruits and vegetables, which are rich sources of vitamins and minerals. As the proportion of calories from fat increases, micronutrient intake tends to decrease. Supplementation with thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, folate, cobalamin, and biotin is recommended to prevent deficiencies. Mineral deficiencies, particularly calcium, zinc, and selenium, have also been observed in KD consumers. Studies have shown that KDs can have suboptimal levels of essential micronutrients compared to recommended dietary intakes. These deficiencies are of particular concern for children receiving anti-epileptic drugs (AEDs). A common population using KDs, as AEDs can negatively impact bone health. KDs have been linked to bone mineral loss in children with epilepsy. The type of KD can influence nutritional status. MCT KDs, due to their higher ketogenic potential, allow for greater inclusion of protein and carbohydrates, potentially mitigating micronutrient deficiencies. Similar nutrient deficiencies could also occur in dogs and cats consuming KDs, especially considering that many KDs are homemade and might not be properly balanced. The high fat content of KDs raises concerns for dogs and cats. Safe upper limits for fat intake, as per the nutrient requirements of dogs and cats, should be considered. KDs, with 80% to 90% of calories from fat, might exceed these limits. This is particularly relevant for epileptic animals treated with phenobarbital, as this medication can cause hypertriglyceridemia. Additionally, epilepsy, its treatment, and obesity are risk factors for pancreatitis, a condition also associated with elevated triglyceride levels. Nephrolithiasis, primarily calcium oxalate and uric acid stones, is another adverse effect observed in human KD consumers. Studies have linked KDs to hypercalciuria and low urinary pH, which contribute to stone formation. It is uncertain if KDs cause prolonged ketosis in dogs, and therefore, the risk of urolith formation in dogs and cats consuming KDs is unclear. Gastrointestinal symptoms like constipation, vomiting, and diarrhea are common in humans on KDs. Constipation is attributed to the low carbohydrate intake and the resulting low fiber consumption. Diarrhea is also a reported side effect, though it may decrease with long-term KD consumption. Changes in the gut microbiome have been implicated in the gastrointestinal disturbances associated with KDs. Studies have shown that KDs can reduce gut microbiota diversity, leading to alterations in the abundance of certain bacterial species. However, research on the impact of KDs on the gut microbiome of dogs and cats is lacking. Study design and methodology. The review conducted by Vindramani et al. 2024 involved a systematic search of the Embase, PubMed, and Scopus databases for peer-reviewed articles and conference abstracts related to KDs or MCT, containing diets in dogs and cats. The initial search yielded a large number of articles, which were then screened based on predefined criteria. The PICO, population, intervention, comparison, and outcome search strategy was employed to identify relevant studies. The search terms included specific keywords related to dogs and cats, MCTs, and various study designs. The final selection comprised 19 articles published between 2002 and 2020 and 3 conference abstracts from 2017 to 2019. These studies were reviewed to assess the current evidence regarding KDs in dogs and cats. Results and discussion. The review highlighted a significant limitation across most included studies. The lack of a definitive assessment of ketosis in the animals. While some studies reported beneficial effects associated with KDs or MCT-rich diets, it is inappropriate to definitively label these diets as ketogenic without confirming ketosis. Ketosis in dogs is typically confirmed when Greek letter beta-hydroxybutyrate levels fall within a specific range. Despite the absence of ketosis confirmation, some studies did show positive outcomes with modified KDs or MCT-rich diets, suggesting that achieving ketosis might not be essential for observing certain benefits. However, due to the physiological differences between humans and dogs, it is uncertain whether KDs induce the same level of ketosis in dogs as in humans. The review also noted the use of high-fat and protein diets in contexts beyond epilepsy and senior dog management, such as in human cancer patients. These diets target the metabolic pathways of cancer cells, potentially offering therapeutic benefits. However, research on the application of KDs in canine cancer patients is limited, with only 3 case report abstracts identified. KDs are being investigated for their potential benefits in various areas, including cell metabolism, cardiac health, respiratory function, and endocrine disorders like diabetes, obesity, and metabolic syndrome. Table 1 presents a comprehensive overview of the peer-reviewed studies included in the review. It provides details on the study population, sample size, intervention details, study design, main findings, and limitations for each study. Table 2 summarizes the 3 conference abstracts, providing a brief description of the study population, intervention, main findings, and limitations for each case report. One abstract highlighted the metabolic effects of KDs in dogs. Borcherding et al. 2019 observed a decrease in lipid metabolites in healthy dogs fed a KD. This study involved feeding 8 female beagles a controlled diet and 2 high-fat diets. Metabolic analysis revealed that the highest fat KD reduced lipid levels, particularly those associated with intestinal membrane structure. Additionally, serotonin concentrations increased on the diet containing 32.1% fat, potentially offering benefits for anxiety and depression. These findings suggest that KDs, particularly those with higher fat content, might be beneficial for animals with intestinal diseases. Conclusions and future directions. The available literature suggests that while pets might not reach the same level of ketosis as humans, KDs can still offer potential benefits in certain situations. However, further research is needed to clearly define what constitutes ketosis in pets, elucidate the metabolic differences in ketone body pathways between dogs, cats, and humans. The review indicates that MCTs may facilitate the achievement of ketosis compared to classic KDs, potentially reducing the risk of adverse effects. However, studies investigating MCT KDs in cats are lacking. The limited research on KDs in pets, particularly in cancer patients, underscores the need for more robust, placebo-controlled studies to provide definitive recommendations for their use in clinical practice. Acknowledgements. The authors acknowledge the support of Premier Pet for the Pet Nutrology Research Center and Veterinary Nutrology Service. They declare no conflicts of interest and confirm the availability of all data within the manuscript. From Vet NeuroJar. Keep those minds inspired, hearts light, and tails wagging.